for diabetes. A lot of us are generally familiar with what this term means. Since you all are in school, you do understand what diabetes means. But what I'm going to do here tonight is go over some general information on things that you may not necessarily know. What is diabetes? Diabetes mellitus, most of us here call blood sugar, sugar diabetes and things like that. But what it just means is that it's an illness that is characterized by the lack of insulin to break down the glucose that's going to go into your body's cells, keep you from basically starving to death. The three types that we know of right now are type 1, which is adult onset, used to be called juvenile diabetes. Type 2, which used to be known as the adult onset, and then gestational diabetes, which is a result of pregnancy. So today all we're going to do is discuss type 1. Okay? Sorry. Okay, what are some of the symptoms of diabetes? Thirsty. That's one of the bigger symptoms because as sugar starts building up in the body, we become very thirsty. So we want to drink a lot of water in order to get the sugar out of the system. The other one is extreme hunger. You're eating like mad, but you're still starving because your cells are not getting the sugar that they need in order to survive. So your body is taking in more foods, it's taking in more fluids, but it can't use any of it because without the key cells, which is the insulin, to break the sugar down, it can't get into the nourish the cells like they need to. Frequent urination is also one of our bigger issues with diabetes. You'll notice the increase in urine. Makes sense, right? You drink more water, you urinate more, right? Okay. And then weight loss. Weight loss, massive weight loss in a short amount of time. So we're talking about 5 to 10, maybe even 15 pounds in a span of 2 to 3 weeks. Okay, so major weight loss is happening at the hands of the diabetes. There are right now currently in the United States about 28 million suffering from type 1 diabetes, about 8% of the population, so it's pretty common. The type 2 diabetes came about as a result of being overweight. Type 1 diabetes doesn't have a real plan of attack, like you're not specific to one category, meaning that it may be some of your genetics, could be a family history, some viral exposure, like exposure to mumps as a child or the Coxsackie virus, sometimes even the West Nile virus, according to the Mayo Clinic. Dietary factors is proven to be one of the bigger factors that causes type 1 diabetes because is breaking down, because the pancreas having trouble breaking down the fat, it's also being infected by the fat, which is where we get the insulin from. So when we start working on these wonderful hamburgers and stuff from Wendy's and McDonald's and that kind of stuff, then we are in trouble because now our body's having to metabolize all this. It's having to break all this down and it's having a more difficult time. Type 1 diabetics, unfortunately, are at a better risk or a greater risk of having long-term effects if they cannot control their blood sugars. Heart and blood vessel diseases like heart attacks, strokes, because they're blocking the vessels. The nerve damage, neuropathy. When you hear about patients getting their fingers and toes and feet and legs amputated, is because they've got neuropathy, the nerves are dead, now they've got to deal with no blood flow, they can't feel, cut their foot, get an infection, and the infection takes over that part of the body. So in order to save the patient, we have to get rid of the part. Okay? Eye damage or diabetic retinopathy is basically blindness. Remember, sugar's floating everywhere. So if it's not under control, then it's going to affect the eyes. It can make men impotent, make women impotent. So there's a lot going on. Wherever your blood circulates is where the blood sugar can actually end up and cause all types of issues for you. When you go to your doctor for your annual exam, these are some of the tests that you can actually ask for to see if you have type 1 diabetes. Again, the average age for someone that gets type 1 diabetes is between The young, 3 to about 14, 16. So they're usually pretty young when has the onset, but it doesn't mean that older adults can't get it either. So if you start having symptoms, these are some of the tests that you can ask for once you get to your physician's office. They can do a random blood sugar test, which means they just take it when you walk in the office. Okay, and this they want below 100. Okay, that's generally speaking. Anything over 200 suggests that you might be at risk for diabetes, or you currently have, if it's been 2 times or more that you've had a random blood test and you come back higher than 200. Fasting blood test, this one is specific to don't eat anything past midnight and then come in here and we're going to check it. In that case, we want your fasting blood sugar to be somewhere between 100 but less than 125. Okay? 125 or higher on 2 tests or more can be the precursor for having diabetes. And then finally, the hemoglobin A1C test, which is a test that's usually can check your blood sugar over a span of time. So we're talking 2 to 3 months, and they can see what your highs and lows have been. 0 is excellent. That's where people that are non-diabetic are. For those that have a hemoglobin A1C between 5.7 and 6.4, is considered pre-diabetic. But if you're 6.4 or higher, you have diabetes. That means your blood sugars have been like 500, 600 over the course of several months. So you want to be careful. Again, this is one of the tests that you can ask for. Okay? Some of the treatments now, great treatment options for diabetics. They take insulin. They have insulin pens now. They've got an insulin pump like the one that I wear. They have the regular syringes and vials if that's what a patient would prefer. We want to talk about exercise and maintaining a healthy weight, especially if we're talking about type 1 diabetics. Type 2 diabetics. But the type 1, they need to still exercise and get up off the couch and start moving. The better we move, the more exercise we have, the less likely we have to keep taking more and more insulin as we get resistant. Healthy eating, that does not look like McDonald's anymore, right? Okay. And then monitoring their blood sugar. These are things that you're going to have to emphasize to your patient. Remember, once we get a certain age, we become set in our ways. So, okay, so above all, we got to teach our patients to stay positive. Because it doesn't matter. If you're upset, we do what we do. We'll eat. We don't take the insulin, blood sugar goes up, we go to sleep, wake up the next day, and now we got to worry about stuff being shot off. Okay? So, I want you to remember, when talking to your physician about whether or not you have diabetes, go back and ask him about certain blood tests that you can take in order to find out if you're going to have diabetes or if you're at risk of being diabetic. Make sure that no matter what, you keep your positive attitude. And remember, that says the healthy, good habits that you adopt today, you can enjoy an active, healthy lifestyle without diabetes and no suffering. It's not necessary. Kill it.